Hello and welcome to HealthReach Diabetes Outpatient Gestational Diabetes Program. My name is Emily Johnson.
And my name is Jane Hackett. We are both registered dietitians and certified diabetes care and education specialists here at HealthReach Diabetes.
Today we're going to be giving you the facts about gestational diabetes and help to get rid of any fears or concerns that you have around your diagnosis. We're here to remind you that gestational diabetes is not your fault. Gestational diabetes is not caused by eating too much sugar, and it's not managed by cutting out all carbohydrates. Any woman can get gestational diabetes, even women who make healthy food choices and exercise regularly.
Your diagnosis may have come as a surprise to you, but once you understand what is actually happening to your body, you will be able to manage your blood glucose levels and have a healthy and happy pregnancy. And we will be right here to guide you all along the way.
Gestational diabetes is diagnosed using an oral glucose tolerance test that is usually performed between 24 to 28 weeks of pregnancy. Some of the things that can increase your risk of developing gestational diabetes are if you've had a prior history of gestational diabetes, if you've had a baby that weighs over 9 pounds, when you've had a family history of diabetes, certain medical conditions such as polycystic ovary syndrome, excess amniotic fluid during a pregnancy. All you have to be is over 25 to have an increased risk of gestational diabetes, if you're overweight, or if you're not Caucasian.
Remember, though, that many of these risk factors are totally out of your control. Often we find that you may have one or two of these risk factors, but sometimes we find that you don't have any.
So what is gestational diabetes? During pregnancy, hormones are produced by your placenta to keep you and your baby healthy. These hormones peak at around 24 to 28 weeks of pregnancy, and they make your body more resistant to insulin.
Now, insulin works to carry that sugar or glucose out of your bloodstream and into your cells so that you can make energy. During pregnancy, your placental hormones make your cells just a little less responsive to that insulin, so your insulin needs often increase threefold. Moms with gestational diabetes are unable to keep up with the demand to make all that extra insulin.
The result of all this? There's extra glucose in your bloodstream, which can lead to complications for you and your baby. Some of the complications that can arise are having a large baby, which tends to complicate delivery, low blood sugar or hypoglycemia for your baby, jaundice, an increased rate of C-section, an increased rate of preeclampsia, and changes to your child's metabolism, which may increase your child's risk of obesity, diabetes, and heart disease.
The good news, though, you can decrease the risk of all of these complications by checking your blood glucose, following your meal plan, and exercising. In some cases, though, if the meal plan and exercise are just not enough to keep those blood glucose levels within range, you may require medication.
So here's what you need to know. Let's start with testing. You're going to be testing your blood sugar 4 times a day, when you wake up and an hour after each meal. A meter can be obtained at your first visit at HealthReach or through your OB office. This is what checking your blood glucose will look like. You will have a meter, you will have a Lancet device, you will have test strips, and you will have a lancet or needle.
Okay.
First, you want to make sure that you wash your hands and dry them thoroughly, so that there's nothing left on your hands before your blood glucose check.
All right.
Next, you will take out a test strip to turn on your meter and insert the test strip into your meter.
All right. A little stuck here. There we go. And then I see there's a little spot there to put
Exactly.
it in.
You will see your meter turn on. And next, you're going to obtain your blood sample. So I'm going to have you take your Lancet device, remove the cap to load in your needle. Simply take the Lancet and put it right inside and push down to secure it, and then remove the tab. Once the tab is removed, you're going to put the Lancet device cap back on firmly to secure. Perfect. Next, you're going to pull back to load your needle on the lever, and then once it is along the side of your finger, you're going to depress the button on the top of the Lancet device to release the needle. Perfect. And you got a droplet right there. You're going to push, and you're going to connect the droplet of blood to the channel on your test strip. Tissue.
Thank you.
And there's your reading, your 102.
All right.
Now to remove the test strip, you simply pull it out, and that can go directly in the trash.
Okay.
For the Lancets, safe disposal of the Lancets once you remove it from your Lancet device would be a Sharps container or an empty laundry detergent or bleach container.
Okay. Great.
And that's that.
All right. So next up, meal planning. During your visit at HealthReach Diabetes, you will be given a meal plan. Your diabetes care and education specialist will help you understand how there are some foods that just seem to raise your blood glucose a little more than others. Because carbohydrates have the greatest impact on your blood glucose, it's very important that you know what foods are carbohydrates and how to count them. Your diabetes specialist will teach you how to count carbohydrates and read food labels during your first visit.
Exercise is also going to help you keep your blood sugar values in range. OB-approved exercise can greatly benefit you and your baby. Regular exercise can lead to shorter labors, lower rates of C-sections. They can help you to de-stress and can play a major role in your blood sugar control. Adding just a 10-minute walk after a meal can help to increase insulin sensitivity and may reduce your need for medications. If you're not already active, you always want to check with your OB before starting any exercise program, however.
In 90% of cases, once you deliver your baby, your blood glucose values will return to normal and you will no longer need to check your blood glucose. This will be confirmed at your 6-week postpartum OB visit when a repeat oral glucose tolerance test is performed. Continuing to eat healthy foods, exercising regularly, and losing weight if you need to will decrease your risk for developing gestational diabetes in future pregnancies and decreasing your risk for developing type 2 diabetes in the future.
We hope this helped to answer some of your questions and calm any fears that you may have. Remember, gestational diabetes is not your fault. It's not caused by eating too much sugar. You don't need to stop eating carbs, and you can still eat some sweeter foods in your meal plan. Your OB and HealthReach team will be here working together to answer any questions and to make sure that you and your baby are healthy.
And remember that we will be here, right here next to you to guide you all the way.